Hello, this is Q Eturatti, municipal election candidate Tampere for the Kokoomus National Coalition Party. My aim is to be the most boring candidate of this election. This time I would like to speak about something I'm repeating often in my materials. It is more questions and less answers. Now, I will explain this a little broadly, but I will go into specific examples in municipal decision making in what I mean. Okay. Broadly put, now there is some hot topic going on social media, and you take 1,000 messages about the subject, and you'll find a good 900 of them often are just straight to the point. They are like, this is the answer, this is the problem, this is the answer, this is what has to be done. Very few of them are questioning, asking, what is this about? What does it mean? What does it entail? What do possible solutions mean? And I would like to turn this upside down. A lot more of these questions, a lot less of these answers. So, in the example of local decision making, I would say, let's start with schools. Now, assume that there is a school where there has been a lot of bullying, perhaps even violence. Typical answers would be something like call the police, give the teachers the power to do whatever it takes, or let's kick that bully out of the school. Questions, however, would be like, what exactly has happened? Let's get as many viewpoints from different people who know about it and hear about it. Let's ask more from the teachers. They are not heard often enough these days, and there's been some public talk about it too. What has been the fuel for this event? What has been the catalyst? And things like that. Trying to understand the package, what has happened, what has been done until now, what should be done next. And here's the very important question: how will we monitor that what we do next is working or not? Now, this is very important, I feel, that before making a decision moving forward, we should define the metrics of how to follow up. Now, for example, this could be a questionnaire to the students, teachers, perhaps parents, some other numbers. I believe the teachers would be very skilled in finding out what these metrics would be. But the basic idea is that before we go on, we already have it written down. This is how we will follow up. This is how we will monitor and see if it helps or if it does not. Not afterwards, not if we remember, not whenever we happen to have the time, but written down in 2 weeks, 1 week, 4 weeks, we will look at these numbers and then decide how to move on. Keep it an active issue. Healthcare. That is another area of example. I'm not a healthcare professional, not a teacher either, but it's important to know because healthcare professionals are very important to us. Now, we know that there's a lot of queues to the doctors. We also know that the nurses, their work conditions are not very good. And typical answer would be, well, let's just hire more of them, or let's hire a consultant to take a look at the problems. Now, these may be suitable suggestions, but how about more questions like, what is the daily time being wasted on? What matters? Take our time, take the time of the medical professionals that prevent them from doing the actual work there. Now, I'm mentioning this because I do believe I know something about IT systems, architecture, and design. And with these questions, we often find that a notable amount of time, depending on the questions exactly, the numbers vary, but they have been from 20 to up to 50% of time is being wasted on waiting for computers or doing unnecessary things with computers, computer programs there. So this would open up more questions. Well, let's look at the other parts of the country. Why, for example, are these problems much lesser in the area of Oulu to the north, and why are these much, much more worse in the capital area? We will find out about these patient information systems, which are key computer programs used at health stations and medical stations, hospitals, and whatnot. And we will find that there's a lot of differences. Further questions would be, how could we involve the staff and get secondary benefits from doing it properly? Now, if the staff feels involved in the process of choosing the system and they feel like their issues are being heard and the problems they raise are being fixed, there will be a more positive attitude at work. And again, a good question, how would that affect the functionality of the entire clinic or hospital? And I think via these questions we could find ourselves in a lot better answers. I did not say we should have no answers, just fewer answers. First, the questions. When a problem is put down, even in political discussion, it tends to be that first you shove down 10 answers and then there's one question. Okay, which one of these will we choose? What if we start with 10 questions and via the answers to them, we get to the good answer, the more useful answer. Of course, this takes more time, but I would rather think that a well-planned operation would eventually take less time than just rushing to a decision and then hoping for the best and fixing the problems with duct tape as they come along, so to speak. I'm going to finish this with just a tiny bit of philosophy. Now remember the ancient Greeks. Who was the wisest of them? It was he who knew that he knew nothing. Now, I don't know. Those are three wonderful words that I see as a wonderful beginning of a conversation. Not the end, the beginning. See, what comes after that is important. I don't know, but I will have to find out. I don't know, but that person is very skilled. I don't know, but does someone have an idea who would know more? These start up the conversation, get up more questions, and bring us to better answers. There are many things in political decision making that I do not know. I have my professional skills in some areas and many others where I need to learn, and perhaps most importantly, trust colleagues, trust other people, and realize that these decisions are to be made together with respect and trust. So that was what I had in mind when I said more questions and less answers. Thank you for listening.